Okay, so there is a point that why pre-oxygenation is very important in anesthesia. Why do we pre-oxygenate the patients and what is the purpose of pre-oxygenation? So pre-oxygenation is done with 100% of oxygen for 3 to 5 minutes, and uh, large breaths are given, and its main purpose, its main role is to denitrogenation and oxygenation of lungs and create oxygen reserve to prevent apnea during intubation. So pre-oxygenation is done for 3 to 5 minutes, and especially emergency patients and patients we who have to be operated for general anesthesia, and we have to create reserve, and which is the most important, to buy time, extra time for intubation. Without pre-oxygenation, desaturation can start within 1 minute. If intubation is difficult, tubes not passing, so desaturation can happen within 1 minute. To prevent that, we have to do pre-oxygenation for 3 to 5 minutes, and it is safe to prevent apnea and manage the oxygen reserve for the patients. And after giving muscle relaxants, we have to pre-oxygenate the patient, and we have to create denitrogenation and oxygenation of the lung, and increase force residual capacity with total oxygen, and replace it, nitrogen, replace nitrogen from with the oxygen. It is very important to do pre-oxygenation of obese, pregnant patient, pediatrics, and patients having lung disease like COPD and asthma, and emergency cases. We have to do pre-oxygenate in emergency cases as well. Now what happens in lungs? There is oxygen and nitrogen. Pre-oxygenation replace nitrogen with oxygen, and denitrogenation take place. Forced residual capacity is replaced with oxygen and filled with oxygen. So we have to do pre-oxygenation. Forced residual capacity, especially decrease in GA or supine position, or any obesity, pregnancy, or anything that compresses diaphragm upward and decreases forced residual capacity, which is 2400 ml. And so we have to do pre-oxygenation, and we have to manage the patients. So if we do not do pre-oxygenation, patient will have rapid apnea, and saturation will fall. In difficult intubation, it is very difficult to intubate because rapid desaturation can happen, and there are risk of cardiac arrest. So pre-oxygenation is very important for buying more time for safer intubation after giving neuromuscular relaxants or neuromuscular blockers. So if some teachers ask you why pre-oxygenation is important, we have to answer that we have to replace the nitrogen with oxygen, denitrogenation, and for that purpose we do pre-oxygenation for 3 to 5 minutes, and we have to create oxygen reserve in forced residual capacity, functional residual capacity, which is 2400 ml, and denitrogenation is and nitrogen is replaced with oxygen. So we have to do pre-oxygenation in order to create oxygen reserve and buy extra time for intubation.